Hello, Nigeria, and welcome back to Cancer Watch, your trusted companion in understanding cancer, treatment, and survivorship. I am your host, Dr. Denise Ejoh, the CEO of Cormode Cancer Foundation. Today, we're going to be talking about lumps and bumps. Don't delay. Unusual swellings, lumps, or persistent bumps on the body can be early warning signs of serious conditions, including sarcoma and other soft tissue or bone cancers. Yet, too often, these signs are ignored or misdiagnosed until it's too late. So this episode of Cancer Watch tackles the urgent need for early detection and diagnosis. And as usual with me in the studio is no other but my co-host, Dr. Biyi, Olutunde, Olusegun. Yes, that was it now. Yeah.
Yes.
Yeah, don't mind me. Co-host it's my public health advocate and media personality, Dr. Biyi Olutunde Olusegun, who represents ACON, our partners on this program. Welcome to the program, Dr. Shehu.
It's nice having you. Thank you very much for having me.
Indeed. We're so glad that you're with us here today. Hello, Denise, and hello, Nigeria, and wherever you're watching us from. Our guest today is joining us all the way from Zaria. Ahmadu Bello University Teaching Hospital is where he works primarily. His name is Dr. Shehu Salihu Umar. He is a consultant radiation and clinical oncologist with a strong passion for cancer care, research, and prevention. He has authored over 40 publications and received as a distinction, the 2023 Association of Radiation and Clinical Oncologists of Nigeria Seed Grant Award for his contributions to oncology research. He is committed to reducing cancer disparities in low-resource settings and currently serves as the deputy editor of the Nigerian Journal of Oncology. It's indeed our delight to have you help us throw more light on this program.
Thank you very much for having me. It's a pleasure, Dr. Dennis and Dr. Thank you.
Thank you. Dr. Umar will help demystify some very serious things that we need to talk about. Firstly, the difference between harmless and concerning lumps, common cancers that present as lumps, including sarcomas, diagnostic steps, and why not delaying saves lives. Treatment options available when caught early, and how public awareness and primary health can play a role in cancer control. Together we fight, together we win. Let's start this conversation.
Indeed, Dr. Shehu, again, you're welcome. But let's begin with the basics. Last week, we had 2 weeks ago, I believe, we talked about bone cancers. And the focus in the month of July is globally on but also on the type of cancer called sarcomas. So, Dr. Umar, can you help us understand what exactly are sarcomas? How do they differ from other cancers? And how do they commonly present?
So, thank you very much for having me once again. Going straight to the point, sarcomas are a group of cancers that affect what we call connective tissues. We have different types of tissues in the body. We have those that line organs, we have those that support the organs, and then we have other ones like the blood-forming tissues and the rest. So sarcomas are connective tissues include bones, the soft, the skeletal muscle, the smooth muscles, and then connective tissues like tendon and nerves, and then fats and the rest. So cancers that affect this group of tissue are actually known as sarcomas. As you have said, the bone cancer, which is part of the sarcoma, has been dealt with. So we are going to talk more of the other types of sarcomas. If you look at the way our body is created, you find out that most of these connective tissues are actually located on the limbs of the body. When I mean limb, I mean the hand, the upper limbs, the lower limb, the trunk of the body, and then sometimes also internally surrounding some organs, for example, the stomach, and some other structures like that. So this group of muscles, this group of tissues, when they are afflicted with cancer, are actually known as sarcoma, as against carcinomas that affect the linings of organs in the body.
Thank you. It's interesting you are talking about it as the limbs on the body, because a lot of us will notice people that have them and not really know that they may be sarcomas, which is interesting. Anyway, what treatment options are available for people diagnosed with sarcomas or other lump-related cancers, and how is the treatment plan determined?
Okay, so before we maybe go into that aspect, I would like to also disabuse our mind. Not every lump or bump you find in the limb is actually a cancer, like malignant stuff. We also have benign lesions. But to the layman, you may not know the difference between the benign one and the malignant ones, especially when it is early. You may just think it's a harmless growth, and usually when it starts, usually small, doesn't cause any symptom to you, nothing life-threatening. And even sometimes, especially when it's coming internally, like within the abdominal cavity, you may not even be aware. It's when it's maybe on the limbs that someone may notice, you either notice it or somebody may notice it. Sometimes when it is like at the back, it's not routine that we check our backs. It may be a significant other that may even notice that there's a bump. But whatever you see, just like once you see a lump or a bump that doesn't resolve within 1 week, 2 days, few days, despite whatever medication, just go to the specialist so that the specialist can examine this thing, and if possible, have a test, and then maybe get rid of it. If it's a benign stuff, if it's a benign growth, the specialist will definitely let you know it's a benign growth and assure you whether it requires treatment or not. If it requires treatment, it is no more than just surgical excision. However, if it's a malignant growth, which we call sarcoma, then the specialist has to evaluate it comprehensively. The first thing you want to know is this really a sarcoma or not? Then you have to take some sample and test. So when it's a sarcoma, the next thing you want to know is where has it spread to? Is it just limited to what we are seeing, or it has spread to some surrounding structures or some surrounding what we call lymph node? So you have to comprehensively know exactly where it has spread to, so that you can be able to know what's the complete treatment package that a patient is going to receive. If it's just something that is localized, then we have the oncologist surgeon that will excise it, not just anyhow, but along the lymphatic planes. But if it's spread locally, then it may require, in addition to the surgery, it may require chemotherapy and radiotherapy. Unfortunately, in our setting, I think due to many problems that we may not be able to highlight now, and I'm sure it has been highlighted in other cancer discussions, somebody will allow a small harmless growth early, you allow it to grow until it becomes so big and unbearable. Bleeding, serious pain, limb immobility, and so many problems before the person comes, when it's already almost late, or when it has already spread to maybe, let's say, the lungs, the liver, and the rest. So the main treatment is actually surgery. However, if patient does not present at a good time, we may have to defer the surgery for other palliative treatment like chemotherapy, radiotherapy, or we just go for symptomatic management where we just try to alleviate the pain. But here we are trying to encourage people to, at the earliest convenience, when you see something like a lump, we're not saying every lump is a cancer, but every lump should be investigated by a specialist, so that if it's a cancer, you address it early, and if it's not a cancer, the appropriate treatment will be given. So the next thing we also want to encourage is sometimes patients actually come early. But they don't know where to present to. They go to some sort of chemist or some quacks who give place them on continuous antibiotics and some other medications. And some even have the temerity to even take surgical operations. And because those surgical operations are done without any knowledge, they tend to even flare the tumor to upstage it and make it even more aggressive in management. So we calling on regulatory authorities to actually check on these quacks, and also calling on people, once you know that a patient presents with something that is beyond your expertise, appropriately refer these patients to specialists so that they can be able to get the best care. And then to patients generally, once you see a lump or even any symptom that does not resolve after some time, you went to one specialist and he still continuously manages you on the symptom. Please find other, make more research and find other people that are specialists that can be able to handle the.
Thank you.
Excellent, excellent. Thank you. Thank you so much. You really touched on a lot of germane issues there when you were talking about treatment. I'm delighted about you saying people tend to ignore swellings because they are not painful, or maybe they didn't see them. And that the fact that early treatment is what's important, and you shouldn't overlook. I mean, here at Cormode Cancer Foundation on Cancer Watch, we don't want to alarm people, but we want them to keep getting that message that early detection saves lives, and that together we fight and together we win, which is why we are constantly raising that. You also did talk about the fact that there are different forms of treatment, but I wanted to ask you how important early detection is in determining successful outcomes for cancers that start as a painless lump. You know, sometimes even concluded or wrongly concluded that it was as a result of a fall, some sort of trauma, incidental findings, and then this causes someone not to present early enough. So how important is early detection, and what are the risks? How worse do things get for the patient when they come late?
Okay, thank you very much for the question. First, I would like to maybe clarify something that you just said, which is important. Many patients, you see them, they're presenting with a lump to you, maybe at already late stage, and then they associate it with a fall, a trauma, or a fracture, and then they attribute it to the fall. So, generally speaking, we classify cancer stage into like 3. We have the localized disease, where the tumor is just within that short, just within what you are seeing. Just that small painless lump, it has not gone anywhere. We have the locally advanced disease where the tumor is a bit big and it has involved some of the, what we call the lymphatic channels. That's like the draining vessels around. And then we have the metastatic or advanced disease where it has spread to distant organs far away from the original site. So when you detect it early, it is most often at that localized disease where the main treatment is just that local excision. And once you are done with the local excision and histology reports that the margins are clear, we don't need any further treatment. What you mainly need is follow-up and the rest. However, if it's locally advanced, you see when we talk about early detection at localized disease, we are just talking of one mode of treatment. But when we talk about locally advanced, we may have to do 2, 3, or even more modes of treatment. Why? Because the thing has advanced, and the layman will ask, we are seeing the lump here, can't you just remove it from me? No, it's not just about removing it. Can we guarantee that when we remove that, there are no lumps in the body also? Once you can't guarantee, then there's no point putting the patient through this difficulty. So early detection makes the treatment variable, makes it easy, single modality, and it's very, very cost effective. And then most often than not, it does not reduce the quality of life of the patient at that particular point in time. Patient is able to continue his or her social life and is able to continue to be productive at the family level or at the society level. But when it becomes advanced, the first thing is the patient himself, the ability to take care of yourself has reduced. You may need significant help of your family, friends, to even just take for self-care. Then you may start spending much resources to first palliate symptoms, bleeding, this and that, before you even go to the main treatment. So it's quite draining, and we cannot overemphasize the importance of early detection. I must also consider that, especially like intra-abdominal sarcomas, they may actually, the first symptom that may present may come out already like locally advanced state. So, but in that type of case, one of the things that we advocate is regular checkup. Once you are doing regular checkup, like yearly or so, some of these things can actually be detected when they are actually in their early form. So, for those cancers that may not be detected early because they are not actually on the surface, regular medical checkup can actually help to detect them early and exclusively.
Thank you. I think we need to take a break now, and we will be back. So viewers, stay tuned. We're still continuing this conversation, and this time we're going to extend it to understand how we can make a difference in society and the public at large. So thank you. Just stay tuned with us. A few minutes, we'll be back. Welcome back to Cancer Watch as we continue this conversation with Dr. Shehu. Thank you, Dr. Shehu, for being with us. And I'm going to ask you my next question so that we can keep going. The conversation is quite interesting, and I'm thinking too many things, As human beings, we always seem to have one lump here or one lump here, and we really don't take it for granted. Now you're making it very clear. We should just not take it for granted. After 7 days, we should go and find out what's going down. So, guys, are you listening? After 7 days, go and get it checked, not after 1 month or what you think or somebody's telling you. What are the risks of self-medication or ignoring these signs? See what I'm saying?
So the risk of let me start with self-medication, and I'm going to combine it with traditional or complementary and alternative medicine. I always tell patients that if you are going to go for self-medication, what do you think you are treating? You don't know what you are treating. So definitely you are just doing a guesswork, and definitely it's not going to work. You need to act based on knowledge. Somebody should help you confirm what exactly are you dealing with. Then they will tell you the appropriate treatment. If you don't know what you are dealing with, then you don't know what you are going through. You don't know the appropriate treatments to actually give the patient. So self-medication is a no. And then complementary and alternative medicine and traditional medication, where they keep on giving you a lot of hopes and everything, is also a no. I do tell patients also that if you take me as an oncologist and give me the pulpit in the church or in the mosque to deliver sermon, then I'm definitely not going to perform. Why? Because that's not my area of specialty. The same thing if you take a pastor or a traditional person and bring to the area of oncology and say you want him to treat cancer patient, then he's definitely going to mess up the protein. So when you have cancer, go and meet the cancer specialist. It's as simple as that. No shortcuts to these issues. And once you come early, as we said earlier, you're definitely going to get better care and at a very cost-effective. So when you come late, even with the best of intentions, when the hopes are really limited, that's what we call prognosis. The prognosis are poorer advancement in the state.
Right, great. Thank you, Dr. Umar. You've really hit on a point for me earlier on, and again, you reiterated it here. People going to the wrong places, even when they present early, sometimes into, say, maybe a pharmacy or some sort of quack doctor who actually excises this, throws away. Some hospitals still take away tumors and throw away. I think public education on the fact that you need to be in a proper approved hospital, and as well as that anything that is removed from your body needs to be tested, is really important. So how can we improve? What role does public education and advocacy play, and how can we improve on this to constantly get people presenting with early diagnosis and also improve access to care? Public education and advocacy. Dr. Shehu.
So thank you very much for this question. It's a question that is very dear to me. If you look at the number of oncologists and specialists in the country compared to the population, it's overwhelming. It's only a privileged few that may be able to have access to an oncologist. So what happens to the majority? We have like less than 100 oncology specialists in the country, in the population with a population of 200 million. So what happens to the people who are not privileged to have access to this person? So my personal bias is that when you look at the demographics, 95% of all the hospitals in Nigeria are primary healthcare centers. And these are the first point of call for people with any symptom. And the people that are managing these healthcare workers, that's the truth, they have very little, or let me say, they have insufficient oncology knowledge to be able to help a patient that presents early with seemingly harmless symptoms and signs. So my thinking is, in addition to the radio enlightenment and many things, like now where we are talking in English, many of the other people don't understand this. They want somebody who they can share the same dialect with, the same culture, like the same religion, to tell them these things and believe. So my thing is, these healthcare workers, can we start training them on primary oncology prevention, so that by the time they see this they tell the people not in English now, in their local language, in a way that is pleasing to their culture, and then those people will definitely accept it better than what we do. I think that's like a more practicable and sustainable approach to enlightenment and actually advocacy, because the real people we need to hit are the people that are not on the social platform. Yeah.
Thank you. You brought my mind all over the place just now. It's interesting when you talk about research and the enlightenment, because I do advocacy with children, and I recall I was doing it in Abuja, and I'm saying this thing very funny, but it's interesting. And I asked the people it was an IDP camp. I said, please, can somebody translate? Because I always make sure whenever I'm talking, we have a translator. So I said to the people, I said, translate cancer in English. It was a serious debate amongst the people trying to give me the exact word for cancer. And that is something that is important. I think we need to put even the word cancer very clearly in all our Nigerian languages, so people know what they are, know that word, and are familiar with it in the first instance. As we round off anyway, let me just finish this quickly. I'm going to ask you one question. Can you give your advice to a cancer patient, a government, and an NGO, what they should do to help cancer advocacy in Nigeria? One sentence for each of them. One for yeah. Go on.
So to the cancer patient, I will always say that at whatever stage you present, there's always something that can be done. Don't lose hope. To the NGOs, I would say that you are doing a great effort and complementing a lot of work of the government, try as much as possible to continue that, but at the same time, learn people's cultural and religious sensitivities to be able to promote the message properly. And to the government, where all these NGOs work is actually the government work, while we acknowledge what the government are doing by creating new machines and everything, if these people are not educated and not enlightened properly, they will continue to present late, and the machines will be of little value to the overall cancer control. So we should invest much more in cancer awareness, not in the traditional way of it, but let us be innovative in what we are doing so that we can be able to have a comprehensive control. I believe that when you have appropriate awareness with even little machine, you get better results than having plenty machine without appropriate awareness. So we cannot emphasize the role of awareness and education on cancer among the Nigerian population. Thank you very much.
Thank you, Dr. Shehu. Thank you. Not every lump is cancer, but every lump deserves attention. When it comes to cancer, time is not just money, it's life. Check it. Don't chalk it up to stress. I'm going to stress, especially in tradition, or simple falls, especially if the lump is initially painless and is slowly or quickly increasing in size. A lump related to an injury specifically is often painful from the get-go. Not every lump is cancer, but every lump deserves to be examined. I mean, that's exactly what we've been talking about today. And so we lose too many lives to to shame, and delay. Let's choose how how more acts or support we're going to give to people around us. Dr. Shehu, I really want to say thank you for your level of enlightenment today. It's really made a significant difference. We have been able to actually address the common issues that come with this cancer journey. To be honest with you, because I live with the disease, I resonate with almost everything you say, and I just hope that the public out there can hear you and understand where you are going. So your last words to everyone, please.
So I would just like to say that we should stay positive and continue to promote cancer advocacy at our different levels. Whether you're a pastor, imam, a scholar, a community health worker, all our collective duty to promote cancer awareness in the appropriate languages and also giving the appropriate or correctness. Thank you.
Thank you very much for joining us today, and for all of you on with us. You can follow us and get involved on this conversation on our Instagram page, Cormode Cancer Foundation. Our Facebook also has the Cormode Cancer Foundation. Our YouTube is the Cormode Cancer Foundation, NIG 281. And our website, Cormode Cancer Foundation, it's actually been updated. So I'll look at what the views and people's comments are. Hashtag us, we are there. You will see this program. You can always rewatch this program sometime in the week. Thank you, Plus TV, for powering this program for us and being faithful to the cause. We want to say thank you to everybody, and to our viewers. Have a fantastic evening.